Today's Doc Talk, we're going to talk about concussions and the acute concussion, the initial first steps to take after you suspected that you suffered from one, okay? But first, the month of September is Concussion Awareness Month. September 20th is Concussion Awareness Day. This is specifically to help bring awareness to people that are suffering concussions but don't feel that they are that they can be open about it. Obviously, with concussions, it's something that we're unable to really determine whether you've suffered from one through images or through any specific one test. So it's very subjective, meaning people have symptoms and it's difficult in order to quantify that. So you can only go by taking someone's word for it, all right? Some people, again, don't feel that they can be open about it. They feel that maybe some people don't believe them, or some people say, wow, you had that concussion so long ago, you're still dealing with that? These things can be frustrating, obviously, dismissing the concerns. And so we want September to be a time that we can promote that and give people the platform they need to say, hey, yeah, this is something real. This is something that I deal with on the daily, and it's not easy. And showing them support is the best thing that we can do to help with that, okay? So with that being said, let's get into it. Let's start off by saying, what is a concussion? So this may or may not be caused by a direct blow to the head, but also to the face, neck, or somewhere else in the body with an impulsive force that's transmitted then to the head. So basically a rapid acceleration and deceleration of the brain. Now, previously we thought that this was that a concussion was due to impact of the brain inside the skull, rebounding off the inside, a counter-coup impact force. But now what we're realizing is this is less the case, that there's actual permanent damage and more of a chemical influx, chemical imbalance that's taken place inside the brain. So the current theory now is that there is a shearing, stretching, and spreading of the neural network, the neural fabric inside the brain, which is then opening up some channels, causing this chemical imbalance. And I'll go into that a little bit further, but this is our current theory on what a concussion is and what's taking place inside. So with that, you're going to get some rapid onset of some short-term impairments, neurological dysfunctions, things like that. Signs and symptoms, they can evolve, they can change within minutes, within hours, days. But again, these are things that more often than not, they can resolve on their own. Some symptoms may be prolonged based on how you approach your recovery. So that's why when you would deal with a certified healthcare practitioner. But again, these acute signs and symptoms are more due to a functional disturbance rather than an actual structural injury occurring in the brain, okay? So if you suffer from a concussion, you can take a little bit of comfort in knowing that it's not going to be permanent brain damage, okay? Necessarily, all right? So, and again, you may or may not have a loss of consciousness. You don't have to lose consciousness in order to suffer from a concussion, okay? Concussions, these can occur at the school, all right, during recess a lot of times, or participation in sports, okay? These are the two common ones for adolescents. These can occur in motor vehicle accidents, all right, commuting to and from work, to and from school. Unfortunately, these things happen, okay? This can happen at the workplace, okay? That's why OSHA is so important, all right? We want to decrease the mismanagement on the work site. That way you don't have any potential injuries, things of that nature. And we salute our soldiers here, Elevate. So obviously they are dealing with a lot and things that entail with war. You can have concussions based on things that occur there as well. But in general, our fall-related injuries usually occur in our very young and our very old populations, okay? And more often our sports-related concussion injuries, they occur more with the children, with adolescents, and with the young adults, okay? So to go into a little bit further on what this shearing force is, the physiology that occurs with a concussion, if you remember your high school physiology, your high school biology, you have your nerve cell here, all right? You have the head, you have the tail, you have the axon, you have the dendrites at the end, okay, that are gonna send neurotransmitters, small chemicals into the next cell, which then progresses to the next cell, all right, like telephone. But inside a specific cell, you have voltage gate channels, okay? And what they're gonna do is they open progressively. So you get signal sent to this nerve cell, it accepts it, then the gate channels are gonna open progressively, step by step, and with each channel opening, you get an influx of calcium and an outflowing of potassium. So you get a chemical change, you also get a electrical change, all right? So we call that an action potential, where the nerve depolarizes, where you're then gonna get this cascading signal being sent down the chain. What can happen with concussion is you get a shearing force, you get a stretch of this entire unit. What it's gonna do is it's gonna open up all these nerve channels, and then you're gonna complete influx of calcium into the cell and an outflowing of potassium in the cell. So the entire cell, rather than do a progressive chain to send the signal, everything depolarizes at once. And so with that, it's gonna take a long time for the cell to then repolarize, all right? And what's going on there is those pumps that we have inside, they are sending out the calcium that came in, and they're bringing in the potassium that comes out. But these pumps require energy, and this is key. When you have this complete depolarization of the entire cell, every single cell then throughout the entire brain, it's gonna take a massive amount of energy for all these pumps to then bring the cell back to normal, all right? To get the chemical imbalance changed, to get the potassium in and the calcium out. And so with this is what is occurring, is there's a massive energy requirement, ATP consumption, that occurs. And so your brain is not able to have, it doesn't have enough energy to function properly, all right? In a normal, healthy functioning brain, 2/3 of our energy stores of our ATP goes to the brain. So if then you have this influx on further need for energy stores, your whole body is just gonna feel like trash. It's not gonna have the energy it needs to do the processes that needs to occur. This goes for the brain, this goes for the body, this goes for circulation, this goes for digestion, and everything in between. So this takes time for the brain, for these pumps inside each cell to then repolarize the cell to get the chemicals to go back and for us to get this normalization, all right? And this is what it takes with this several days. That's why generally the recovery process is what, about 30 days generally. Everyone's different, right? Based on your signs and symptoms, how you're feeling, testing and retesting, but this is the general consensus. It takes several days. It takes 30 days plus to gain that normalization, all right? So that's what's going on. There's a massive demand for energy, and the body doesn't have enough, so you're gonna feel off, all right? And this is where you get those delayed symptoms later on. So you're gonna get maybe some low-grade headaches, some lightheadedness, drop in blood flow, all right, when you're position changing. Poor attention, concentration issues, you're gonna have memory issues, you're gonna be easily fatigable, easily irritable, potentially light disturbances, all right, noise disturbances, things of that nature. So just the brain feels different, feels off, all right? And this is what's going on, is what we think, okay? So, what do you do if you feel that you suspected or received a concussion, all right? Quick acute signs and symptoms, big one, loss of consciousness. Doesn't have to be, all right? You don't have to lose consciousness to have a concussion, but this is a pretty telltale sign that you have one. You could also experience seizures, all right? You could also have a vacant stare, just a very blank facial expression, okay? You could have delayed verbal or motor responses. You could be very slow to respond to questions or follow instructions. There could be a lot of confusion or focus attentional deficits, some disorientation, slurred speech, uncoordination, you're moving strange, you're not able to walk smoothly, and then emotional disturbances. You start laughing suddenly, you start crying suddenly, okay? These are all signs that you may have gotten a concussion. So what do? If this is a sporting event, you take that player out, all right? If you have any of these signs or symptoms, okay, that person should not be playing, okay, for at least 24 hours, okay? Give them time to observe the patient, make sure that the player isn't digressing, getting worse symptoms, okay? These are signs that you likely need to take them to the hospital, okay? Just to get checked out and prevent, and just to rule out any further issues from occurring, okay? And the big thing, don't leave the player alone, again, for the first 24 hours. Always be observing them, making sure that they don't have any digression in symptoms, okay? What you then want to do is, after those first 24 hours, you just want to take it easy, okay? Nothing strenuous, nothing excessive, okay? But you do want to make an appointment with a healthcare practitioner, okay? Someone that is trained in treating concussions, because what we're finding is the earlier you're able to visit a healthcare practitioner that has training and expertise with concussions, you're gonna have a better and quicker alleviation of these prolonged symptoms that can occur, okay? So this is what we found in the research. But again, this first, if you felt that you've suffered from a concussion, immediately get a clinical exam, all right? We want to get a comprehensive history. We want to do a full neuro exam, all right? We're going to check on your mental status, cognitive status, all right? Your vision, your vestibular, all right? Your balance and your gait, making sure that everything neurologically is working well, okay? And if not, we can then outsource you to the appropriate practitioner, okay? Education is key, okay? Knowing when you should be referred out, knowing that this likely is not a permanent structural damage that occurred if it is concussion, that this can be repairable if you take the right steps accordingly, okay? But the big thing with that initial exam is to, again, rule out from anything further, any potential brain bleeds, any skull fractures, any vertebral fractures, okay? Make sure that there's nothing wrong with the neck, all right? Rule out all of those things that could progress this issue further, okay? And then from there, once you've had that initial go-ahead, the first day, take it easy. Then after that, you want to progressively start becoming more active. So the Berlin Concussion Statement, which comes from a worldwide overview of what is the best way to treat concussions. This is the Berlin Concussion Statement that said that after a brief period of rest during the acute stage, the first day or two after an injury, patients are then encouraged to become gradually and progressively more active while staying below their cognitive and physical symptom exacerbation threshold. Meaning, after that first day or two, you then want to promote more activity. So this is low-level cardio, this is walking, this is maybe riding a stationary bike, anything that's not going to be jarring or potentially aggressive towards head movement, okay, that could trigger anything further, all right? But what a recent research article in 2016 found that after early participation in physical activity within the first 7 days of injury, we found an association with a lower risk of persistent concussion symptoms compared to those that engaged in no physical activity. What we used to think is that rest, okay? No light, no vision, no loud noises, just rest. But we found that this is actually going to be detrimental. This is actually delaying your recovery process. And instead, what we want is light physical activity that, again, does not set off your physical or cognitive symptoms, okay? So you want to keep it at a level that does not give you, this doesn't make you feel worse, okay? If you're able to progressively stay at a specific heart rate, let's say, low level resistance without any symptoms, then you can progressively, slowly build it up a little bit the next time out, all right? And then no symptoms there, then you can progressively go from there, all right? So we want a slow progression of activity after that initial day or two of rest, okay? And then after that first week, you do return to the specialist to reevaluate, to determine if there's been any progress with the systems or if there's a need to take an appropriate next step for therapy, okay? So I hope to discuss more of your persistent, your long-term concussion symptoms in another doc talk, but these are the initial steps to take if you initially suspect that you've dealt with a concussion or experienced a concussion.